But the next topic is the Norway, the land of opportunities, and I would like to welcome two of our guests. The first one is Mikaela Roxana Zipman from Faculty of Medicine in University of Bergen. Welcome. And the second one is Maria Dushinska from Health Effects Laboratory, New Climate and Environmental Research Institute. Thank you for coming. Maria is a Slovak, but it will be easier that we all will be speaking in English. I beg your pardon for my English because the last time I was using it, it was at the previous etapa. So, Mikaela, we'll start with you. There is EHCY index, and in this index, Norway is usually scoring very high. It is usually among the 3 or 4, the worst 5 top performing healthcare systems in Europe. So could you tell us a little bit about the ways how the healthcare is being provided in Norway and about the system, etc.?
First of all, thank you for the invitation. It is a pleasure to be back in Bratislava. I have enjoyed a long time collaboration with Maria Dushinska and Nilu from Oslo. And also with her colleagues from the Institute of Cancer, where we, together with them, we participated in a Euro-Nanomed project, where new nanomedicines were developed for treatment of cancer resistant to treatment. And we were in charge in that project with testing of the safety of these new nanomedicines. I've always regretted not seeing much of Bratislava, like now because of busy schedule. But now, because of this new invitation, I hope to see more of it. And I'm very happy to extend the collaboration that we started. It was easy to say yes. We want to find new points of synergy, complementarity, and also to extend the level and the area of collaboration. So thank you very much. I cannot speak, I don't represent the Ministry of Health. I'm a scientist, mostly basic science scientist, but I can speak mostly coming from, because I come from the Department of Clinical Dentistry. So we deal with treatment of patients who need dental treatment. So I can speak from this angle. And I know that in most of the polls, dentists scored very high in the trust of the population. And I think the reason is that very good programs were set in place by the government and the Ministry of Health, where there's a very good follow-up of children. They receive free treatment until they are, so children and young people until they are 24. So this age was pushed recently to 24, it was lower before. But also other categories such as elderly patients, defavorized categories of population, also received different degrees of state-funded
taxpayer-funded
care. So, yes, oil also, but oil used wisely, I would say, yeah. So, the whole population benefits. So most of the healthcare is state-funded. There are also private actors, and maybe this is something that everybody faces these days. We're talking about lack of resources in general, but I think the focus should be put maybe mainly on the lack of human resources. Because
you're facing the issues regarding doctors or more of the nurses?
All levels, I would say, but of course for wealthier countries it is easier to attract working force from other countries, but still there is a lack of personnel and maybe also facilities. There's more tendency towards centralization these days, and that means that people in more remote areas don't have direct access to healthcare, and there might be long queues. So from my experience for acute treatment, so let's say heart or AVCs, heart attacks and so on, accidents, also for cancer treatment, there are very good programs in place, but for more chronic diseases, there can be very long queues. So then the private actors come in.
I see. Maria, could you tell us that you're from Slovakia? How did it happen that you end up in Norway, and when?
First, thank you very much for this invitation. It's a great pleasure to be here, and those I am already almost 20 years working in Norway. I still have my home in Slovakia. I am only a resident in Norway. This is home, and there is home. And I have very good collaboration with my the former colleagues, which are also present colleagues. So we have several grants from European Commission, European Union, but also Norwegian Slovak grant, and some of my collaborators, medical doctor and scientists, are here. So I'm very, very happy to be here. So. I don't know. I got opportunity to work abroad, but never wanted to stay abroad. I wanted to be there only 1 year, and now.
You're prolonging it year by year.
No, I immediately got permanent position, and I was very unhappy because I didn't want to stay. And when you have permanent position, then you have responsibility. So.
I see. One of the it's the question for both of you. One of the solution, and I wouldn't say easy solution, but the solution in order to deal with the lack of human resources with doctors, nurses, and other medical stuff is innovations, is data-driven healthcare, etc., etc. And we can say that Norway is very successful in these areas. So could you tell us a little bit more about how Norway succeeded in implementing innovations and data-driven policies?
So maybe I can say, because I should say why I stayed in Norway. So when I went there, so I was just thinking to write a project proposal, and we got first FP7 project nanotest, where our role was to develop testing strategies and in vitro alternative methods for testing nanomaterial in nanomedicine. And the project was prolonged for 5 years, so that was the reason that I stayed. And then we developed a laboratory, established a laboratory where we started to focus on in vitro models and alternative models, advanced 3D co-culture models, which are mimicking more situation in vivo, in a living system, to reduce the testing on animals. And also with Mihaela, we focused on nanomaterials and nanotechnology and safety of nanomaterials. And these are, you will hear today, a very unique materials with fantastic features, but those which could be beneficial could be also harmful. So our role was to test these materials to ensure that only safe materials will be further produced to the products. So.
The question was how the innovations in general and data-driven policies in Norway help you to eliminate or reduce the problem of lack of personnel working in healthcare.
It is a challenge. I don't know how this will be solved in the long run, but it is a challenge. And also the number in the young generations is going down. So yeah.
So let's go, just a kind reminder, you can also post your question through Slido using hashtag ESN2024. So if you want to join the discussion, you can do that through the Slido. So let's go to the nanomaterials and their safety and how they are being developed. So if you are comparing nanomaterials, let's say 20 years ago, with the current nanomaterials, what would be the crucial difference?
there is, of course, an increased degree of complexity for the new nanomaterials. What I would say is standing out is the increasing use of nanomaterials or products of nanotechnology, especially in medicine and dentistry. And that's natural because if we think the building blocks of living matter, we find it at nanoscale. So all the tissues, DNA, whatever. So it is natural that we develop materials that are closer to the ones that nature has built. So then we have to go to the nano level. And there are benefits, as Maria has very well mentioned, with introducing nanomaterials because of their unique properties. But there are also side effects, and these should not be neglected. So if we think about plastic, for example, which is now a problem because of accumulation, you find it almost everywhere. If also parallel with climate change, I think it is better to try to solve things in advance. And here is also where computational analysis in silico modeling and so on can help. But this cannot be done properly. Any model needs valid data. And that's where Maria and we come in. We are producing testing methods, standardized, reliable, and also biological models that are closer. They mimic the real life situation and real life exposure.
So I can just add that there is a lot of innovation in this area in the nanotechnology, and it is really a very fastly developing field. And what also we are doing and other our colleagues, it has application in other areas in generally in chemical safety, for example. So, for example, these 3D new models or the approach which is now followed, what we call safe and sustainable by design, that we are trying to implement safety issues immediately with designing nanomaterials and also to ensure sustainability and circularity. So, for example, the future research will be focused on so-called digital passport, that you know from the starting designing nanomaterial, for example, or other materials, advanced materials, through the development and production to the waste, and to use the waste material and again to use it to reduce the waste and harmful compounds in the environment. So the research now, thanks to Norwegian support, it's and also at the European level, it goes to the multidisciplinarity and to different fields. For example, in health, we are talking about One Health approach, where the focus is on human health, environment, and animal health. So the.
Could you try to mention some of the examples of how nanomaterials are being used in the current medicine? What is the biggest development or the biggest success regarding to nanotechnologies?
Yeah, together with Mihaela, we had actually Slovak, the Norwegian, not only Slovak, Norwegian, it was a nanomedicine project which was actually coordinated by Slovaks from Cancer Research Institute. And we aim to develop what we call combo bomb, combined drug for drug delivery for breast cancer. It is, of course, our role was to develop the models as well as to look at the safety issues. But I think this is very innovative approach to use nanomaterials in drug delivery, because they pass through the biological membrane much faster than standard drugs. And if they are packed in some liposomes or some nanomaterials, nanoparticles, so it's much more safe, because then they are targeted directly to target organ, for example, tumor.
Let's talk a little bit about the safety of using of these materials. So it is safe to use nanomaterials for a human body, and for maybe not only in human medicine but also in veterinary.
Well, nanomaterials are everywhere. They are really ubiquitous, but and not many of them are harmful. But those which are harmful, we would like to exclude or diminish their use, for example, on the areas where there is no other alternative. The unique properties are, for example, the small size, they penetrate, they go through biological membrane, and they don't stay only in the target organ, but they can be translocated to other organs, and because they are the particles, they don't, body doesn't release them, or the release of nanomaterials is very, very, very low. So it could be like a chronic exposure. I don't know, Mihaela, if you want to add something to that. So that's why we really need to reduce or eliminate those which are not safe. But also for the industry to save money and effort and time, because if the safety, if we test them early in the development, so that we can say not go to this way, but to that way. So
we are working together, and the project Maria mentioned is a very good example of that. We are working together with the developers, and the final aim is to have, as Maria said, efficient and but at the same time safe products to use, and not only safe but also that these materials are produced, disposed of, have a life cycle that takes into consideration sustainability, so also environmental effects. And regarding what you asked, we have in Norway, it's called Felles Catalog, where you find all the medicines that are used in Norway, and there is a good number of nanomedicines or nano-based products that you find there for cancer treatment, antifungal, antimicrobial, you name it. And in dentistry, almost every or many of the types of treatments and materials that we used can have nanomaterials incorporated.
Can nanomaterials once be used as a replacement for human organs, that we can create nanomaterials and to build or grew, or I don't know what should be the correct expression, any organs, and we would replace it? Or it is too much of sci-fi?
I give taking into consideration I could call it huge leap that we are seeing now in development of science, AI, materials, nanomaterials, and so advanced materials. I think only our imagination sets the limits. They will be, of course, used, but yeah.
There are many young people among us, so this is probably the question from them. In Slovakia, we have a problem with some dentists who use unapproved invisible braces, Turkish Invisalgen. How can... You can see the question, how can the patient defect it? Is the first question on the screen.
Yeah.
How can... Yeah. Can we
well, I can say for Norway, and it is for sure in Slovakia the same. Only CE art materials can be used, so sold and purchased. And when it comes to the responsibility, the end responsibility lies with the dentist, with the dental practitioner, of which of these materials he thinks are most appropriate for that particular patient. So that's the only thing I can say from Norway perspective.
I see. Okay, and the second question from Swada is, if you could give some advice for you younger self in accordance to our career and studies in branches of medicine and science, what would it be? It's for both of you.
If I can say, if you have a vision and courage and some dream, definitely you will achieve it. So, I mean, it's hard work, but it's not hard work if your field of your area of your work is your hobby or your, you know, it's just everyone could have a different talents and different dream what one could do in science, because science is or medicine, there are so many areas where one can find useful work, but the most important for me, from my experience, it's just courage and enthusiasm, and that's then easy to achieve. I mean, I have also experienced working in Slovakia, and it's valid everywhere, in every country. Of course, in every country there are problems. It's no ideal country on the world. We are lucky working in Norway, so maybe some administrative or financial problems are not that big as in other countries, but most important is to have enthusiasm and to have courage to overcome problems. That's my experience.
Mikaela?
I would say where there is passion, there's a way.
Yeah.
I can speak from my own experience, like Maria. I finished the faculty of dentistry. I worked as a dentist, part-time or full-time. And now I'm working in science, in nano-safety of nanomaterials.
You're not practicing dentistry anymore?
No, not since 2012. Yeah.
Do you miss it?
It is very good. I liked it. You see immediately the result. It is a great satisfaction. I'm more attracted to science. So once I was given this opportunity, I followed this path 100%. So don't be afraid to explore. Nano was not even, when I was studying, we didn't even know about nanotechnology.
I see. So the next question is, how does nanotechnology enter the human body?
Yeah, so I already said that it depends on the route of exposure. If they are in the air, so they go through lung to the body. If it's a drug, it could be injected. If it is in food, because we have also in food packaging nanomaterials and in food, or cosmetics through the skin and through the intestinal system and through the food. So there are different routes of exposure, and this is why we developed advanced in vitro models and what we call it mini tissues and mini organs to mimic the situation in a body. As I said, there are different routes of exposure, and then they easily pass through biological membrane. And if they enter nucleus, which is still under investigation, but there is a proof that some nanomaterials can pass through nuclear membrane, then it's a problem if they could be genotoxic or mutagenic. So, and then, of course, all mutagen and genotoxic agent could be carcinogenic. So that could be the biggest health problem. So.
I think I'm running my fourth etap, and I have never experienced so many questions. So this discussion has really raised some questions. So let's proceed with the next one. How does the innovation ecosystem work in Norway? Is it possible for you as the university to easily collaborate with hospitals or healthcare authorities? I think it's for both of you.
Yeah, we can say yes, because Michael actually found me, and we as a scientist, we knew who is working in the field of nanosafety. For example, also ecotoxicologist and human toxicologist, and collaboration is encouraged in Norway. That I can say.
Yeah, it is easy to collaborate with hospital and healthcare authorities, and not only, also the Ministry of Environmental Health.
Yeah.
We had direct visits there
Yeah.
with regards to development of test guidelines. And,
one example is that we got the European project, and it was really like flagship in a nanosafety. And Norway managed to include 7 partners, 7 institutions to this project, but it should be 80% financed by national funding and only 20% from the European Union. That was Horizon, I mean, it was FP7 still project. And then we decided to visit the ministry, and we tried to persuade them, and then we organized workshops and explained how important this topic is. And then they didn't give us directly money, but they announced the call, which was open for all scientists. But as we had a 7 institution and history of tracking history that we are actually experts in the field, we got this money. So.
Yeah, that's another thing for Norway. Everything is open, so everybody should be able to apply.
You can't get money that, okay, you are good, you get money. You need to fight for it still.
Yeah. And the ecosystem, at the University of Bergen, we have a body called VIS, who is in charge of patenting, so all the innovation has to go through them. So they take care of also of the legal aspects, connect to legal relevant entities and with implementation. And so we can't do it by ourselves. We have to go through this VIS that is affiliated to the university.
Out of curiosity, what is the percentage of the foreign students in Bergen? You know?
I can't say about the percentage of foreign students. It's going a bit down because now they have introduced fees for those who are outside EU, so that number went down. But I can say that the number of PhD students is about 50% or maybe slightly higher from foreign countries. Yeah, so it's very open. That's one of the beautiful things of science. It has no borders, no, just a passion for what we are doing. Yeah.
I am actually interested in the question that what is our view on nanotechnology and conspiracy theories related to the spreading of our internet. What I can say, because I can compare Slovakia and Norway, I'm very often here, and I can say that Norway as country is very similar to Slovakia, 5 million people there, here, and also historically, I think, and politically, how the independence arose and so on, there are very many similarities. But in Norway, people are trusting, they trust institutions. Institutions are well established.
They do not have a kotwar, you know.
Yeah, and they conspiracies, probably some immigrants and so on, but I don't, it's not a major problem. I think they really appreciate scientists and expert medical doctors, and institutions are well established, and that means that people are not having problem to follow or trust what the government or what the institutions say. Even in Corona time, every Monday we got instruction what to do. There was a good link between a government institution, people followed. It was really no problem. When it comes to protection against Corona, we got directly at the institute. People could get, how do you say in English, očkovaní.
Vaccination.
Vaccinated, and everyone was. I don't think
you didn't have nanochips in your vaccines, right?
Pardon?
You didn't have nanochips in your vaccines? It was just for Slovakia.
And I don't see anyone from scientists or medical doctors that would question this. I don't know anyone.
Nobody was
in
questioning
Norway,
from the medical doctors.
or from scientists, or from people.
You are
around
still
me.
sure there are many similarities between countries?
No, I said but. There are many similarities, but.
Okay, it's the last question. If nano organs were to be implemented, how long would be the testing take? Would the nano body refuse it, or how can we ensure adaptation to nanomaterials? And body and I found out that I need better glasses. So.
Yeah, it's difficult to give a general answer on this. I think the question was maybe about nano-based organs or nanomaterial-based organs. But of course, it depends from case to case. It's very difficult to give a general answer to this question. Only testing can give the answer. And when it comes to nanomaterials in general, we need long-time clinical studies to give us the answer about how they perform. But regarding what Maria said and your initial question, why is the health system working so well in Norway? I think the key element is trust of the population in government, that they try to do the best for them, and trust of the government in the population that they will follow the recommendations, because during COVID, the population complied mostly, I can say generally, voluntarily, so by their own free will, no hard.
So that was no force, but people really trust. The difference, big difference, is that experts are appreciated, and those who are not educated in the field, they don't have voice, I would say.
They trust you. I saw it as a dentist working
nice
with
imagination.
Norwegian patients. They trust you do the best for them.
Thank you so much. So thank you to Mikaela Roxana Simpen and to Maria Dushinska. Thank you, ladies.
Thank you. It was a pleasure to be here.
Pleasure.